In this video, we will discuss about osteoarthritis. Osteoarthritis is a degenerative disease that causes the tissues in the joints to break down. It is different from osteoporosis, which is a condition that causes the bones to become brittle. Osteoarthritis is more common in men, however, over the age of 45, it is more common in women. Though each person may experience osteoarthritis differently, you'll commonly experience increased joint pain and stiffness in your hands, knees, hips, neck, or lower back. It is not possible to cure or reverse osteoarthritis, but there are treatments that can help you manage the symptoms. So let's talk about these home remedies and treatment. Number 1. Hot and cold compresses. When it comes to pain, hot and cold compresses may be very beneficial. They don't cause the long-term side effects that medications might. Hot compresses are helpful for joint stiffness, and cold compresses are best for joint pain. The Arthritis Foundation says that heat helps soothe stiff joints and relax muscles, while cold helps numb sharp pain and reduce inflammation. Compresses can reduce muscle pain or spasms surrounding a joint. Making a compress can be as simple as using a warm or cold towel. Number 2. Epsom salt bath. Epsom salt baths can provide all-over relief, especially for joint pain. The magnesium in Epsom salt may help with inflammation and pain. Soaking in an Epsom salt bath for a prolonged time may increase your magnesium levels. Number 3. Green tea. Green tea contains polyphenols. These compounds may help lower inflammation and the need for medications. Use of green tea in treating the osteoarthritis have proved that the tea can help with joint function. Due to the risk of liver problems and side effects from concentrated amounts, it's best to drink green tea in moderation. Number 4. Ginger. Oral ginger is also noted for reducing pain from osteoarthritis. Taking ginger long-term may even decrease the risk of osteoarthritis-related disability. But ginger overdose can cause upset stomach, diarrhea, and heartburn. It may also interact with prescription medications, like warfarin, because it's an anticoagulant or blood thinner. Speak with your doctor before adding or increasing your consumption of ginger. Number 5. Turmeric and curcumin. Curcumin is the active compound in turmeric. It's part of the ginger family but may help osteoarthritis in different ways. Curcumin may be able to slow disease progression and provide pain relief. If you want to try turmeric as a natural treatment, it is recommended to use curcumin extract and not whole curcumin, as it may be contaminated with lead. Take 500 milligrams twice daily. While turmeric is generally safe, it can cause nausea and may interact with blood thinners. So these are some of the home remedies you can try in order to get relief from osteoarthritis. Consult your doctor with any questions you may have regarding your medical condition before applying these home remedies. If you find this video informative and useful, hit the like button and please do share and subscribe to our channel to get future video updates. Thanks for watching.